everyone, thank you for joining our virtual dental shadower session. We want to remind you that in order to get your hours, you will have to take a short quiz, and as long as you score a 3 out of 5, you will earn your hours. The quiz link will be located in our link tree, which is in our Instagram bio. Alright, so let's get started. We are very fortunate to have Dr. Ayzin for today's session. I'm handing the mic over to you now. Feel free to start whenever you want.
Alright, hi guys, thanks for having me. My name is Dr. Ayzin. I'm a cosmetic dentist, basically a general dentist who focuses on cosmetics. I actually also do a lot of surgery, and I'll get more into that soon. I've been where you guys before. I know how it is to be pre-dental, how in college, and you don't know what's going on, what's new, so this is actually really good that you guys are doing this. It's awesome. Perfect. So, just a little bit about me. I'm from Newport Beach, California, born and raised. I live here now. I moved away for a while, but now I'm back. I went to college at USC, right on. And then I went to dental school at UOP in San Francisco. For many of you that don't know, UOP is the only 3-year program in the country, and I'll be happy to talk about that if anybody has questions. And then I finally did my AEGD residency at UCLA. And if you guys don't know what an AEGD is, probably because a lot of people don't know until you're in dental school, it's just another year of schooling or training after dental school that you don't have to do but can do if you want more advanced training in dentistry. Go for it. So I'm going to start off with a little bit of advice for college since you guys are in college and you guys are in here for the dental shadowing. So this is my advice. I'm going to be super blunt, by the way, during my entire presentation. I'm very straightforward and honest. I'm going to tell you how it is, and if you guys have any questions on that, I'm happy to answer any question, either at the end or whatever, and I'll answer the best that I can. So first, my advice for college to get into dental school is first shadow a dentist. Ideally, if you can, maybe assist and be a dental assistant or work in a dental office. Maybe work in the front as a receptionist, work on the insurance end or whatever. Maybe get paid for doing it while you're at a dental office. And why it's so important to work in a dental office is you gotta make sure that you actually want to be a dentist. Some people just want to be a dentist because they think it's a glamorous job, or we make a lot of money, or we barely work. And while we make pretty solid money, and I actually travel a crap load, I still work a lot too, and the money isn't worth it if you don't absolutely love what you're doing. Thankfully, I love what I do. I love being a dentist, and so the money is just a bonus for me. So you got to make sure that you want to be a dentist. And dental schools want to make sure that you want to be a dentist. Because some people go to dental school, do all this work, take out these crazy loans to pay for dental school, get to dental school, and end up deciding that dentistry is not for them. Dental schools don't want to invest their time and money in into people that aren't going to be dentists. So that's huge. I can't emphasize enough how important that is. Another great thing I recommend is joining a pre-dental club. I was part of a pre-dental club in my college. Most colleges nowadays have a pre-dental club. I highly recommend doing that. It gave me great experience. I got so much exposure to the dental school at USC. I got great experience in dentistry. I was volunteering with the dental school because of that organization. You're with like-minded people that want to be dentists as well, and you guys all help each other and just become better because of it. And it also just gives you kind of new experiences that you might not be able to get. I mean, I was drilling with a handpiece, so a dental drill, on fake plastic teeth while I was in college, and I thought that was a super cool experience. Kind of confirmed my desire to become a dentist. And it just looks great on your resume. It shows, again, dental schools that you actually want to become a dentist. Next is volunteer work. I mean, I think it's pretty obvious. You should have volunteer work for not only your resume, but just because it's a good thing to do. It's great to give back. I've done a bunch of dental mission trips to Mexico, to Fiji, a few other places, LA. I did a bunch in LA, just kind of everywhere, and just got to get the volunteer work. My pre-dental club helped me out with that a lot. Obviously, you have to have pretty good grades for dental school, so you want to get the best grades that you can, but that does not mean if you have not the best grades or even bad grades at times, you can't get into the dental school. You have to be a well-rounded person. Dental schools want good people. They don't just want a computer who can get an A. They want good people, so if you don't have the best grades, that's okay. Just make up for it in your resume in some other way. Make your portfolio rounded. Become desirable in other ways. But it is easier, and you can get into a better dental school if you have good grades. So do the best you can. So that's all for kind of making your resume look good and my advice for college. But more importantly, I want to talk about taking care of yourself mentally and physically. I can't stress this enough how important it is. Do not kill yourself in college, literally and figuratively, by the way. Trying to become this best resume that you can. Enjoy college and enjoy yourself. Take time for yourself. If that's working out at the gym, playing sports, hanging out with friends, reading, going to the park or the beach or whatever, make sure you take care of yourself. Because if you can't be healthy for yourself, you can't be healthy for your future patients, your friends, your family, whatever else. So please keep your life balanced. I promise you, I worked very hard in college and dental school, but there is time to have fun. I had so much fun in college, I had so much fun in dental school, and I'm having even more fun now. So trust me, take care of yourself, and if you are healthy mentally and physically, then you will just be more efficient. So if you're studying for 20 hours straight, it's time to take a break. 20 is ridiculously too much. You are just not even efficient at that time. You will be so much better if you are healthy. So, like I said, enjoy life in college. And then finally, again, I'm going to reiterate how important it is. Make sure that you actually want to become a dentist. So important. All right, next slide. So, I don't know why the title, I think I'm messing with Tyler, sorry. I wouldn't call this choosing specialties, which is kind of what I do and like becoming a general dentist. As a general dentist, you really can do anything in dentistry. If you want to become a specialist, like an oral surgeon, or an endodontist, which is like a root canal specialist, or an orthodontist, someone who does braces, you absolutely can do that. And I would urge you to not decide until you're in dental school if you want to specialize, because you really don't know anything about becoming a specialist, even if you think you do, until you're in dental school and you truly understand what those people do. But as a general dentist, I love it. I like having variety in my life. I love doing every aspect of dentistry, from fillings to crowns to implants to root canals. I love it all. I love being with people. But I specifically focus on oral surgery and cosmetics the most. So I'm doing a lot of oral surgery, and I do a lot of cosmetics, a lot of veneer cases, a lot of implants, a lot of wisdom tooth extractions, all that kind of fun stuff, and then everything in between. So I'm a general dentist with a focus on oral surgery and cosmetics. So the education that I needed to get to this point was obviously dental school. I have a kind of skill set that your typical general dentist does not. Most general dentists aren't placing the implants or doing the kind of big case surgical cases that I'm doing, or taking out the difficult wisdom teeth that I'm doing. I do kind of what an oral surgeon does as a general dentist. But to get to where I am, I did an AEGD. That's a great way to get implant experience. So another year of residency to learn how to place implants and stuff. So you can do an AEGD or a GPR. The difference is an AEGD is typically more like clinically based, and then a GPR is more hospital based. And I'm happy to talk about that if you guys want. You don't have to do that. You can become a dentist right out of dental school, and then you can learn what I learned through continuing education courses, CEs. So you can take special classes, pay some money, take some classes, learn how to place implants, and then start doing it. Or if you're super lucky, you can get a fantastic mentor, find a really great dentist, surgeon, whatever, who wants to mentor you, and they can teach you everything you need to know just from them. And if they teach you well and you feel comfortable, then you're able to do whatever you want. So there's so many different avenues to get to the place that you want to go. It's just what's right for you. All right, next slide. So what's a typical day like for me as a dentist? Honestly, I don't have typical days, which is why I love being a dentist. Like every day is slightly different. I honestly don't know what's going to happen each day. Sometimes the schedule will be empty and all of a sudden I've just done like 10 crowns, or I've done a bunch of wisdom teeth extractions or something else, or just kind of everything just changes. Like today, for example, I took out 6 wisdom teeth and did a couple crowns, and then Thursday I'm doing a huge implant surgery, and then tomorrow I have no idea what's going to happen. We'll find. I haven't even looked at the schedule, and I love it. Every day is different. It keeps me on my toes. I don't get bored, which is so fun to me. For me as a dentist, my office practice is I try to be able to provide everything a patient needs in one office. So kind of like a one-stop shop. Maybe you've heard like the term like a super GP. That's kind of like what my goal is. I want to have my patients get all their needs in my office, so they don't have to go to like a specialist here or there. They come to me for everything. If they need a root canal, I can do it. If they need an implant, I can do it. If they need a cleaning, my hygienist will do it. If you need a filling crown, I got it. Whatever else. But like I said before, my patient base and practice, I kind of end up doing a lot of oral surgery, like implants and wisdom teeth extractions, and then I do a lot of cosmetics like veneers, and then a couple root canals every now and then, yeah. But like I said, the best part of being a general dentist is you can do whatever interests you. So if you like something, you can do it. Some people don't want to be orthodontists. We do a lot of Invisalign at my office, so I'm doing a lot of ortho. I'm doing a lot of Invisalign. Some people like root canals. You can make sure that you have a practice that does a lot of root canals. Some people hate root canals. You can refer those things out. You don't have to do a single root canal if you don't want to. That's so cool about being a general dentist. All right, next slide. So that's kind of my my inspirational stuff / just kind of lecture. Now I have a few dental cases of mine that I want to share. I have 5 cases. I think they have a huge variety. I kind of want to show you the kind of a broad spectrum of what I do and what's possible out there. I am pretty young, obviously, and you can still do this. I'm doing a lot of cool things, so age doesn't stop you. It's just your experience, your knowledge, your skill, and your comfortability. So here's my first case. Love this case. This patient, 23-year-old girl, hated her small teeth. Oh, by the way, if anybody has a question, they need to stop me on a case, please stop me. One of the moderators maybe stop me, and I'm happy to answer the questions on the cases or anything. Or write it down, and I'll answer at the end, whatever you guys want to do. All right, so patient hated her small teeth. She's got small teeth, gaps showing in between her teeth, and why she hated it, she just felt like it made her look really young and immature. And personally, I completely agree. I think she looked like she was 17, and she's a very beautiful girl, but she looked like she was 17 with these teeth. Nothing but wrong with them per se, just not kind of what she had envisioned for herself. So simple, straightforward, 10 veneer case. We did 10 veneers. Do I have control of the mouse? Can you guys see my mouse at all?
No, we can't actually because you're not screen sharing.
No? Okay. Never mind. And you probably, well, okay, whatever. So 10 veneers. We did it from a premolar to a premolar, which is the tooth before the molar. Pretty obvious. I'll try not to talk too dentally complicated because I know you guys aren't in dentists yet. So the 2 teeth behind the canines to really make sure her smile is nice and full. And with 10 veneers, huge improvement. I mean, these look really nice, looks very nice and natural. While yes, they're definitely wider, it's not like you would stare at these and think, oh my god, she's got veneers or she's got crowns or fake teeth. And that's what we wanted. We want to have nice natural teeth that fit her. She could not be more ecstatic. I mean, she was crying when the veneers came on. She saw the mirror, and she's so happy. She constantly texts me how much more confident she feels about herself, and she's just so, so happy. And that's what I love about being a dentist. So I love cosmetics. Cosmetics is probably the most rewarding feeling for me in dentistry because we can really change people's lives in such a small way through their teeth and make them feel confident. And confidence really is a game changer in our lives. It affects us in everything we do. And if we can improve someone's confidence and their quality of life just by fixing up their smile, I mean, I think it's a no-brainer. It's amazing. I love oral surgery because it's fun, but nothing feels better than this. All right, next slide. So here's another case. This is a little bit of a combination of oral surgery and cosmetics. I think it's a really, really cool case. So obviously the patient is missing her front tooth. She had a car accident and lost her front tooth. She actually had the tooth missing for like 3 or 4 years, finally saved up the money and was ready to fix it permanently. So I did one dental implant in the missing tooth, or missing front tooth here. And we also did a veneer on the other one. And look how much better her smile looks. Look how that flows. I think this is an incredible looking case. I have other photos that I don't have here, but of the surgery and stuff, and it just looks phenomenal. You cannot look at that after picture and tell me that doesn't look like her real teeth. It looks so natural. It matches well. She is so happy. I actually posted on my Instagram story, and I have a lot of dental friends and stuff, and a lot of cosmetic dentists, and I only posted the after picture and I asked which one's the implant, and literally no one, like out of 200 people, maybe 10% guessed right, and that's less than chance. So it looks great. This is a really awesome outcome, and this is what you guys can do. You can do surgery and cosmetics and really change people's lives. It's a huge drastic change, and it looks really good. All right, next one. Here's another big case. Huge, huge improvement. So obviously, on the before, the guy is missing most of his front teeth. He had severe decay on those back teeth on the upper, as you can see. It does not look good. He cannot chew and function properly. This is a nice combo case again. I ended up doing like 3 or 4 implants, I can't remember, 3 or 4 implants on the upper, and I replaced all those broken down crowns or decay on the upper teeth and put new crowns on them and transformed his smile and function. He can eat normally again. He can bite into a damn sandwich. It's a very underrated ability for people to eat the foods they want to eat. So not only does this person look better and happier, but he can eat better food, have a more nutritious diet, and is actually healthier now because of this. So huge transformation. Might not be perfect aesthetically. I see a few things myself that I want to improve, which we did later on after I took this photo, but still really nice, overall great outcome, and patient couldn't be happier. All right, next slide. All right, I want to show you guys this case because it's really cool. This is actually one of my cases I did in dental school. So the first 3 I've done since I've been a dentist. I want to show you guys this because I want to show you what's possible while you're in dental school learning. Not as easy of a case as you think, by the way. So this patient, she had an accident as a child when she was like 8 and fell on her front teeth, and the front teeth died. The front teeth, the front 2 are very lingually tipped, so they're pointed towards the tongue. This picture does not do it justice, but the teeth are pointed almost all the way back to the tongue. I mean, it looks, the other teeth are just facing opposite directions. And they're discolored. Patient hated them. She was just so unhappy. So I did a few things here. First, we did the 2 front teeth, clearly. We did a couple crowns, nothing too crazy, pretty easy. But look at that shade match. I think it looks real nice. It fits in so well with her smile, flows beautifully, so natural. I wanted to do a gingivectomy. I wanted to bring her gums up a little higher on those front 2 teeth. We couldn't because of the accident. There was too much bone loss in the area. I don't want to bore you guys with that, but we couldn't. But I see that. But still, overall, really nice. We also whiten her teeth a bit, so give her a brighter smile. And then finally, if you guys, I don't know if you guys can notice or not, Since we were already doing the 2 front teeth, the patient didn't like her canines. They were just too long for her and too sharp, and she just felt like she had like these fangs. So I ended up rounding out her canines really softly so that the canines and the rest of her teeth flow in her smile with her lip. And really small, minor changes can have a huge impact on the smile and the overall feel and flow of it, and really nice result. And this is all while I was in dental school. I was a student. And so I think it's really cool that you're able to do this. And so it's kind of, I just want to inspire you guys to know that you can start doing cool things from the get-go in dental school. All right, next one. Oh, I had one more in there. Is that gone? There it is. Okay, last case here. I have pictures of this case of after, but I also have pictures of the surgery. This is a surgery case, something called all on 4. I didn't put in the surgical pictures because some of you might be squeamish. I don't want to scar anybody, but for anybody that wants to see pictures of it or any other stuff, you guys are, later on I'll give you my info. You guys are able to email me or message me. I'm happy to show you. But this is something called all on 4. So patient had terminal dentition. Their teeth were royally messed up for whatever reason, severe gum disease, rotting teeth, whatever, not savable. So we ended up taking out his lower teeth, shaving down the jawbone, putting 4 implants in, putting a prosthetic in there, and now he's got a whole new set of teeth, a new whole set of teeth in his mouth permanently, with implants and a bunch of other stuff. I'm doing this as a general dentist. I think that's freaking awesome. I get giddy for this. I have another one of these cases coming up later this week. Love it. It is seriously this is actually life-changing in every way. He has no more infection in his mouth. He can eat again. His teeth were so loose before. Now he's got real teeth in there that are in his mouth. He's confident. He can eat. He's healthier. It's just seriously, and that infection in his mouth will go to his heart, cause heart disease. Even if he doesn't have diabetes, but if someone has diabetes, it can make the diabetes worse. Just all this kind of stuff. So really awesome stuff here. So I want to show you guys this because if anybody likes surgery, if maybe they're thinking of being an oral surgeon or something else, well, you can get your fix doing stuff like this. I know this makes me happy, and it's just cool to know the variety of what we can get as dentists. All right, next slide. So my advice for you future dentists out there, find your why. Why do you want to do whatever you want to do? If that's dentistry, why do you want to be a dentist? If that's something else, why do you want to do it? For me, my why is a perfect, healthy smile enables a person to reach their maximum potential in life. And I truly, truly believe that. I really believe that if someone has a nice, healthy smile, that person can be more confident, they can be healthier, they can be happier. And when you are those things, you are able to be the best version of yourself, and that allows you to succeed in ways that you couldn't before, or you couldn't have if those things were not happening. So I really believe this. That's my why. So my advice to you guys is find your why, but still enjoy life while doing it. Okay, next slide. So here's my email. It's my direct email. If you guys have any questions, you're welcome to email me. I'm pretty slow with emails, unfortunately, but I promise I will answer them typically within a couple days. Or you can message me on Instagram. I'm a lot more responsive on Instagram, typically. That's my personal Instagram on the bottom. We have an office Instagram in the middle there, Dentistry at its finest. That's my dad, though. My dad's a dentist, by the way. We work together. So my dad controls that. So if you message that, you'll be talking to him, not me. Or you can message me on my personal Instagram, Ron Ayzin. My Instagram is a personal one. It's not really dentistry that much. I do post like some dental stories pretty much every week, and sometimes a dental post here and there, but my Instagram isn't very dentally focused, so I apologize if that's what you're looking for. But you're welcome to message me or email me for any questions. I'm happy to answer. I have been in your guys' shoes. I had many people help me along the way. I asked a crap load of questions, and I was fortunate enough to have some pretty fantastic mentors along the way. So I would love to get back. I love giving back. I know where you guys are at, and if I can help in any way, I'm happy to.
So we do have a couple of questions for you. So the first question is, I am interested in UOP Dental School. Would you mind sharing some insight on what characteristics do the school want from their applicant?
Sure. By no means am I in admissions, so I don't know admissions per se, so I can't give you exact answers on that. But I will say UOP is a fantastic dental school. In my opinion, just a great, great place. I loved going there. Great environment. I had such an awesome knowledge base there. I learned so much. I had some great faculty out there. So if you want to go to UOP, great choice. The 3 years doesn't hurt at all. I kind of joke, even though like 3 years is very busy and hectic, I can't even imagine doing dental school in 4 years anymore. But just not talking badly on any other schools, but UOP is a great school. In terms of what they're looking for, UOP has a reputation as being more of a general dentist focused dental school, and they want people with good hands. They want people that are balanced. They want just good people. They're not looking for bookworms. They're not looking for people that are just stuck in research and nothing else. They want to know that you're a good person. They want to know that you have balance. They definitely need good grades, don't get me wrong. I had a couple classmates that had bad grades and still got in, so that's not an end-all be-all. But they want people that are doing everything. So kind of the advice I gave you, just follow that earlier, and that will help you for UOP.
Our next question is, in your dental case 1, is there any other option other than veneers?
Absolutely. In her case, it was just by far the best option. We could have done something called composite veneers. So still we call it a veneer, or what we can call it bonding, or we can just put kind of filling material over her teeth, and that would have definitely been another option. It'd be very conservative also. I wouldn't have to drill on her teeth probably. It just wouldn't look anywhere near as good, and wouldn't last at all, not compared to the veneers I gave her. She could also do nothing. She could also just whiten her teeth, but leave the gaps. Some people are super aggressive, and I would not recommend this, but you could do crowns on all the teeth. But that's too aggressive for me. I like to be conservative if I can. That's kind of, for what her goals were, those are kind of pretty much the only options.
Okay, and our third question is, has your why dentistry changed over the years? If so, how?
Honestly, no. That's been my why from the beginning. I kind of saw that happen with my dad. I saw him, in my opinion, change a person's life. A woman, an older woman, went from just so unconfident with herself, so sad, hiding her smile every time she talked or laughed, to not stopping smiling. She was beaming from ear to ear, and she could just tell she had a different energy about her, and that's been my why ever since.
And our next question is, what was the toughest class in dental school for you, and how did you overcome it?
I don't know, probably microbiology or pharmacology because they're so freaking boring. Microbiology, just learning about bacteria, and I found it so boring, but some people might like that. Or pharmacology, because again, it's just so boring, like learning the pathways of medicines. I mean, it's important, don't get me wrong, and sometimes I wish I paid attention slightly more for pharmacology, but those are probably the most difficult just because I couldn't stay awake.
Okay, and the next question is, UOP has a 3-year program, which a year less than other dental schools. Does it make the curriculum harder and more condensed? Was there enough time to prepare for the boards?
So I'll answer that as truthfully as I can. I think it was definitely plenty of time for everything we needed to do and learn. I will say we hustled our asses off. First year was definitely very difficult, but I still went to the gym like 4 or 5 days a week. I still went out probably every other weekend at least in that first year, And then definitely I was with friends every weekend after the second and third years. It's definitely time. I will say, yes, it's more condensed than other schools. Definitely had to study for boards while I was doing other things, so I didn't have as much free time for like that. I will say, honestly, I think UOP is kind of a little less focused on the didactics portion, so a little less focused on the science classes than maybe some other schools I know, but they are very heavily focused on the clinical hand skills aspect of dentistry, which I really appreciate and love. So definitely 3 years at UOP was great for me, so it's definitely doable.
The next question is, what was the biggest hurdle once you graduated dental school?
It's a good question. I guess a good. I was pretty fortunate. I don't think I experienced too many hurdles, to be honest. But a few hurdles that I kind of experienced, / that many people experience, is just finding the right office for you to work at or buy or whatever. Some places are gonna maybe ask you to compromise your ethics in order to make more money or be faster or whatever. And I urge you guys not to do that. You can definitely be fast and make money without compromising your ethics. So if someone wants you to compromise what you believe, either with your practice or whatever else, or your treatment planning, I urge you not to stick to your guns and stick to who you are. You can find what a right home for you. I know you got student loans to pay. I got student loans. Promise you, don't worry about that. We make plenty of money for that. I pay my loans. I'm never worried about my student loans. Do good dentistry, and the money will come.
The next question is, how do you cope with patient expectations?
Super important. That's a great question. 100%. Make sure you tell the patient what to expect. If you promise something and underdeliver, you're fucked. If you don't tell them what to expect, they're not going to be happy. If they're surprised, no one likes surprises, but no one hates surprises more than a nervous, anxious patient. So I always tell the patient exactly what to expect before I do anything. If I'm going to give them a shot, I'm going to tell them what to expect. If I'm about to do a wisdom extraction, I'm going to tell them, hey, you're going to feel a whole lot of pressure this whole time. That's normal. You might hear a crack or two. That's normal. I give people expectations. For denture patients, dentures suck. So I tell patients that. I'm like, look, you're going to hate your denture. You need to understand this. That's why I push for implants, because implants make life way better, way more normal. But if the patient can't afford it, then they're in a denture. So you gotta. A lot of people / patients don't know what dentures are like. They think it's, oh, I have new teeth, I'm cured. But no, dentures are a whole new ball game. It's super important to manage expectations. So I'm super blunt with patients. I'm very straightforward and honest. I will tell patients exactly what to expect. If it's good, if it's bad, what I expect to happen. I get ahead of that curve right away.
So the next question is, what is the hardest thing about teamwork in a dental practice?
That's a good question. The hardest part is always money. Money is the hardest part for everything. Everybody wants to make more money or treat more patients or whatever else. And a lot of times there's miscommunication between the front and the back, because the front office, like the receptionist and your office manager, wants to have you see more patients so the office can make more money. But maybe, sorry, it's my dog. Sorry, guys. Sorry. All right. Anyways, the back, which is like me or the assistants and stuff, might be overwhelmed seeing too many patients sometimes, and so we get mad at the front. But because like, hey, you're overwhelming us, and so it's always kind of a fine balance of seeing enough patients that everybody's happy, but not being overwhelmed in the back. So it's not too stressful or whatever. So I would say kind of communication from the front and the back is the toughest part, for me at least, in the dental office.
So the next question is, are there any tips you could give us on personal statements?
Honestly, I don't know if I'm the best person for that. I'm a terrible writer. I will tell you this. My admission officer told us when we were in dental school that everyone's personal statement sucks. No one does it well. It's like they laugh at us when we write our personal statements. We think we're doing so great. We've worked so damn hard on it, but they say that everyone sucks. So if that makes you feel better, for the fact that I definitely work hard on it, do your best, but you're not going to impress them, I promise. I will say my one advice is try to show them something about yourself. Most dental schools want unique, good people, so show them a bit about yourselves. Don't be that cookie cutter. Oh, I fell in love with dentistry once I went to the dentist and they fixed my cavity, and now I love dentistry and blah blah blah. Really show a piece of yourself as best as you can. But that's a question for your admissions counselors, not me.
And the next question is, why did you decide to do an AEGD program?
Great question. I will say, honestly, coming out of UOP, I felt very comfortable to be a general dentist on my own. I was ready to work, no problem. But I wanted to place implants. I wanted to do complicated surgeries, and I did not get enough experience in that at UOP. I had got a great experience, but most dental schools don't teach implants or placing implants, whatever, the surgical process. I knew I wanted that. So I found a specific AEGD, this one at UCLA, that had a reputation for doing lots of implants, having a great experience, and I'm so happy I did. I learned so much at that AEGD. I got amazing experience, and I came out a better dentist with a much wider array of skills. So that's why I did it for myself, just to get myself to the next level, if you will.
So the next question is, what is your favorite tooth and why?
What's my favorite tooth and why? Okay. I'm going to go with two. One is the molar, because it's the most fun to do stuff with. You chew it, you use it all the time. It's the most important in the mouth for function. And typically that's where I do a lot of my surgeries in some way, either wisdom teeth or implants or whatever else. And the front tooth, because it is the first thing to be noticed and the most life-changing for somebody.
The next question is, don't veneer preparations make teeth sensitive?
They definitely can if the dentist does not do things right, or doesn't plan the case out correctly, or doesn't examine the patient correctly, or isn't well prepared. But honestly, and while it is possible, it typically does not happen if the case is well prepared and the dentist does their due diligence and someone who's experienced / knows what they're doing.
And the next question is, why do dentures suck?
Great question. Dentures suck, honestly. And I'll tell you why. I'll tell you basically what I tell patients, but maybe a little more condensed because I don't want to waste your guys' time. Teeth are in our jaws, in our bone, attached to our heads. Dentures are not. Dentures are basically a dental plastic, an acrylic, and all they do is they sit up on our gums, and they just have a suctioning effect, but it's just plastic in your mouth that's not attached to anything. So the way that they stay in is they either suck up, or the patient's tongue and lips have neuromuscular control that hold the dentures in place. So chewing it goes to shit. Talking is so hard until the patient gets used to it. They look okay if they're well made, but in my opinion, the aesthetics suck too. Even if they're well made, I make great dentures, but compared to any other stuff I do, the dentures are nowhere near as good looking. And patients can't just eat real foods. They can't bite into a sandwich or bite an apple or eat a steak. So yeah, dentures suck. And I try to tell all my patients, if you can avoid a denture, please do for yourself, because you're not going to be happy. If you can't, you can't. We'll make it work.
The next question is, for case number 3, since the patient was missing many of their front teeth, could a bridge have been used instead? Was a bridge not ideal since the upper back teeth were already crowns?
Great question. And the answer is he had a bridge there, a very long span bridge. and it failed. And the reason it failed is that span is way too long. There's a lot of physics in dentistry and a lot of rules that you guys will eventually learn, but you don't want to put that long of a span of a bridge on teeth because it causes way too much stress on teeth. Because of the stress that bridge put on, he ended up losing teeth. So that's why we did an implant bridge, which is the shorter span, and implants are stronger in ways. So the implants were able to handle the span, and I made it shorter, and so forth. So yes, he had a bridge, failed, and that's why he lost teeth, and that's why I did implants for him. And yes, great point. They already had crowns, why not do a bridge? So, of course. But that's why. And also replace the old crowns with new crowns to get them healthy again.
Okay, and for our last question we have, I am planning to apply as an international trained dentist. Have you ever come across some international student at UOP, or do they have separate class for them?
Absolutely. Yeah, UOP does have an IDS program, so an International Dental Student Program. So I definitely know a decent amount about it. I would say the IDS, the international students, and the US students are pretty separated, honestly, because we have different things to learn. Until about my last year, when we're all when they joined us, well, their last year, when they joined us for clinic. So UOP, you're in clinic pretty damn early. You're in there like at the end of your first year, pretty much, which is wild. But so I would see them in clinic every now and then, and so then I had some interaction with the international students. So I would say some. I wouldn't say a lot of interaction.
Okay, and that is it for question and answers. Thank you, Dr. Ayzin, for taking the time to talk to us about your profession. It's truly appreciated, and I know I learned a lot from your presentation. And to our viewers, our quiz is going to be linked in our link tree and in the description of this video. The quiz will stay open for 24 hours, after which it will close and scores will be sent out. Again, a reminder, a 3 out of 5 is required to receive credit for our session. And to Dr. Ayzin, I want to thank you again for today. Everyone, have a wonderful day.
Thanks, guys, for having me. Appreciate it.